I'm going to start.
Hello and welcome to University Hospitals Dorset. Today we've got not just one talk for you, we've got a series of talks all about how to take care of yourself during pregnancy. And we're delighted to be joined by our maternity team from Poole Hospital based at St Mary's. So over to them. Thank you very much.
Hello. My name's Kerry Taylor. I'm the Head of Midwifery at University Hospital Dorset, based at St Mary's site in Poole. We're delighted to be here today and have the opportunity to present to you some cases on how you can look after yourself during your pregnancy. We hope over the course of the next year we'll be able to run a number of sessions covering various elements of the pregnancy, labour journey and the postnatal period. And we hope in the future to be able to run a specialist session for partners about how they can support their new family throughout the journey. But today I have my wonderful team of midwives with me who are going to present to you various ways in which you can look after yourself during pregnancy.
Hello, my name's Susie. I'm one of the community midwives attached to St Mary's at Poole. So I'm here to talk to you about being active in pregnancy. So activity is the act of purposefully engaging in moving your body or maintaining or improving your physical fitness, and it's essential. It's one way of maintaining a healthy lifestyle. So being active in pregnancy can lower your risk of pregnancy problems such as gestational diabetes or high blood pressure, and can have a positive impact on labour outcomes. It can also reduce the likelihood of common pregnancy complaints, excess weight gain, aches and pains, as well as helping you sleep better, improving your mood and reducing anxiety. So what's recommended? The Chief Medical Officer recommends that pregnant people should exercise for about 150 minutes of moderate intensity each week, so just over 20 minutes each day. This means activity that increases your heart rate, but not so intense that you can't hold a conversation. If you are already active, it's safe to carry on. So if you enjoy a run, you don't have to stop just because you're pregnant. Just listen to your body and adapt if you feel certain activities are becoming more uncomfortable. If you experience pain whilst being active, then you must stop. If you aren't active currently, then it's recommended to start slowly and gradually and build up. Why not take a walk? You can take a walk in the fresh air outside, or go for a leisurely swim with a friend. So what counts as activity? So there's a few there on the slide. A little brisk walk, swimming, yoga, there's Pilates, deep cleaning the house. Oh my gosh. Sorry. Taking the stairs. And dancing to your favourite music, and just playing with your children in the park if you already have children. Things to consider. So we don't want you overheating. Try not to bump your bump. Don't overdo it. And if it starts, please stop. It's advised to avoid contact sports, so rugby when you're pregnant. Additionally, just practice some caution when there is a risk that you may fall, such as horse riding, and we definitely do not want you scuba diving at all through your pregnancy if possible. So for further advice, please get in touch with your midwife, or you can self-refer to Live Well Dorset for a free health MOT and information about how to get active in pregnancy. They can support you and your partner too. So there's a little web link there. Just visit livewelldorset.co.uk. There are other areas to access as well as other links. There's the This Mum Moves and the Active Pregnancy Foundation to give you a little bit more in-depth advice. A little bit about nutrition in pregnancy. So it's quite important to eat well and of a wide variety of nutrients, nourishing foods that can help you avoid common pregnancy ailments such as anemia, whilst helping your baby to grow healthily and strong. So by eating well in pregnancy and being mindful of the food choices, you can avoid excessive weight gain and reduce the risk of gestational diabetes too. So did you know that maternal diets contribute to the establishment of the epigenetic profiles of their baby, which can have a profound impact on the susceptibility to certain diseases or disorders later in life? The maternal diet may also impact on the early establishment of the fetal and neonatal microbiome in the gut. Increasing numbers of people are considered undernourished in the West, despite eating well and frequently. So that will be due to the variety and the intake of micronutrients in the diet. There is no need to eat for two. That's the myth. Let's bust that myth. 2,000 calories a day is sufficient until your last trimester, where you require just a further 200 calories, so maybe an extra piece of toast each day, and that depends on your activity level as well. So what should I eat? The NHS recommends eating a complete and varied diet, which includes plenty of fruits, vegetables, whole grains, nuts, seeds and legumes, and that's all packed with wonderful vitamins and minerals, and that's crucial. Aim for about 5 or more portions of fruit a day and vegetables, and try to switch it up a little bit, so just vary what you have. Whole grains are high in fibre and will keep you fuller for longer, as well as helping with the avoidance of constipation, which we hear about a lot. You should try to avoid processed foods, but understandably you may not be able to, but so just maybe vary your diet a little bit more. Try to avoid fast food as it contains high saturated fats and sugar, so leading to, again, gestational diabetes. So there's a little list there. So number 1, we suggest protein. This is good for developing muscles and new tissues in your baby and yourself. Whole foods, plant-based sources of protein like beans, chickpeas, lentils. They can count as 1 portion of your 5 a day. Other sources, we've got meat, cheese, poultry and eggs. Obviously, if you're vegetarian, you might want to have more of the plant-based foods. So we've got number 2 on the list, omega oils, which is important to promote the neurological development in your baby. You can get omegas through dietary sources such as eggs, oily fish, so no more than 2 portions per week, nuts, seeds, soybeans, and dark green leafy vegetables. And then there's calcium, which is number 3 on our list. Very important for the healthy development of teeth and bones. And you can get calcium from dark green leafy vegetables, cruciferous vegetables like broccoli, nuts and seeds, and dairy products and eggs. And did you know you could actually get that in squash? The butternut squash contains a lot of things. I had to add that in, sorry.
I didn't know that.
So things to include: fruits, vegetables, especially the dark green leafy varieties, whole grains, nuts and seeds, beans, as we discussed earlier, red line approved eggs. Things to avoid, as we also discussed: highly processed or fast foods, unwashed produce, unpasteurized or mold ripened dairy products. That's your lovely French cheese. Undercooked meats, fish and shellfish. Cold cured meats such as salami and pepperoni, chorizo, unless you've cooked it thoroughly. Liver and liver products, pâtés, please don't eat that. Game meats such as goose, partridge or pheasant. I'm not sure if anyone eats kidneys anymore, but please avoid.
Yeah.
Sweetbreads, isn't it? Sweet meats.
Sounds good.
That's it.
Happy?
Thank you.
Thank you. So we'll move on to talking about immunisations in pregnancy now.
Hi, my name's Sonia. I'm one of the community midwives based in the Poole area. So immunisations in pregnancy, protecting you and your baby from avoidable illnesses. Immunisation is a way of protecting you against serious diseases. Once we've been immunised, our bodies are better able to fight these diseases if we come into contact with them. Immunisation acquired in pregnancy will transfer to the baby, so they are better protected from disease when they are born. Whooping cough, the official name is pertussis, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. Pertussis spreads easily from person to person, mainly through droplets produced by coughing or sneezing. The disease is most dangerous in infants and is a significant cause of disease and death in this age group. Vaccination of pregnant women is highly effective in preventing disease in infants too young to be vaccinated. The pertussis vaccine is available once you are 16 weeks pregnant. It's actually recommended between 16 and 32 weeks. It is available from the antenatal day assessment unit in Poole, as well as your GP. Please ask your midwife for more details or look at the leaflet on badger notes.
I think it's always important to say as well with whooping cough, isn't it, Sonia, that you need a vaccination for every pregnancy.
Absolutely.
So the vaccination is for the baby, not for the mother.
Yes, and babies do actually receive their first dose of whooping cough with their immunisations at 8 weeks. So that's why we recommend between 16 and 32 weeks, because if you have it by 32 weeks, the immunisation is passed to the newborn and it protects them up until their first vaccination. Seasonal flu. Flu is a highly infectious virus that occurs every year, usually in winter. Symptoms include fever, chills, headache, aching muscles and sore throat. While it is a mild illness for most people, it can be very serious for some. Research suggests that pregnant women are more likely to develop serious complications and be admitted to hospital as a result of flu compared to women who are not pregnant. Getting the flu during pregnancy can also lead to increased risk of miscarriage, premature birth, or having a low-weight baby. Receiving the flu vaccine during pregnancy helps protect both you and your baby from catching flu. Young babies are more at risk of being seriously ill if they catch flu because their immune defence system is not fully developed and they are too young to be given the flu vaccine. You will continue to be protected throughout the flu season and therefore less likely to pass flu onto your newborn baby. And the flu season is generally beginning of September to the end of March. The flu vaccine is now available at University Hospitals Dorset. You can get the vaccine by walking into the main outpatients on either site, be that Poole or Bournemouth, on a Saturday afternoon between 1 and 3. And soon from the antenatal clinic in Poole as a walk-in on Friday afternoon. We don't have the dates for that yet, but it will be coming soon. You can also get the vaccine from your GP. Please ask your midwife for more details and read the leaflet on badger notes.
Just one other thing to say about flu is that thankfully maternal deaths are really low in the UK. But every year there will be some women who die as a result of flu in their pregnancy. And every death that we have throughout the country is closely investigated to see what were the issues, how did the death arise, and what could we learn from this. And for a number of those ladies who've died in the last 10 years from flu, their only risk factor was that they were pregnant. They didn't have any other risk factors at all. And that's why there is such a strong national campaign for encouraging women to have vaccines for flu in pregnancy.
COVID-19 has not gone away and may be more dangerous in pregnancy. Hospital admission and severe illness are more common in pregnant women. 1 in 10 women admitted to hospital with COVID-19 require intensive care. If you have COVID-19 in pregnancy, you are twice as likely to have a stillbirth, and it is twice as likely that your baby will be born prematurely, which can affect their long-term health. Having the vaccine makes it much less likely that hospital admission will be required. 96% of pregnant women admitted to hospital with symptomatic COVID-19 since the 1st of February 2021 had not received a vaccine. COVID-19 vaccines do not contain live coronavirus. Vaccines do not contain any additional ingredients that are harmful to pregnant women or their babies. Other non-live vaccines, such as whooping cough and the flu, are safe for pregnant women and their unborn babies. The COVID vaccine is available now at University Hospitals Dorset. You can get the vaccine by walking into the main outpatients at both sites on a Saturday afternoon, same as the flu, between 1 and 3 p.m. Additionally, you can get the vaccine at your GP surgery. For more information, ask your midwife or read the leaflet on badger notes. Some women may have already had their COVID-19 vaccine and think they've only had 2, and that's fine, but the 3rd and 4th booster are important as well. And just to end on the immunisations, Kerry touched on it about how it can affect pregnant women a lot more. You might not have any other risk factors. One of the reasons why the immunisations are really strongly recommended as well is because when you're pregnant, your body is working so hard to develop your baby that your immune system is slightly weaker, because obviously everything is going towards the baby. Thank you.
Thank you very much. Our next session that we're going to cover is smoking in pregnancy.
Hi, I'm Sam. I'm the smoking in pregnancy midwife. So smoking is the single biggest modification risk factor in pregnancy. Quitting smoking is the best thing you can do to protecting your baby. Did you know there's over 4,000 chemicals in cigarettes, and a large majority of these do not filter through with the placenta, so they go directly to your baby. One of the biggest ones is carbon monoxide. This chemical is a poisonous gas which stops oxygen from reaching your baby for 20 minutes after you've had a cigarette. And the lack of oxygen can affect the baby's growth and development and can significantly increase the chance of miscarriage and stillborn. Roll-ups are not better than straights, and cutting back does not prevent your baby from undergoing harm. The best thing you can do is quit completely. Smoking in pregnancy accounts for 1 in every 3 sudden infant death cases, 1 in 12 premature births, 1 in every 5 cases of low birth weight, and 1 in every 4 premature related deaths. Smoking in pregnancy can also cause placental complications, low birth weight and growth restriction, cleft lip, gastric cystis, and shortening limbs. It can also cause childhood asthma and hearing problems, attention deficit disorders, hyperactivity and learning disorders, miscarriage and stillborn. It can also cause an increased chance of having an induction of labour and an increased chance of having a caesarean section, as well as the increased risk with sudden infant death syndrome. The great news is we can help you quit for good. At UHD, we have an award-winning smoking in pregnancy service. You're 4 times more likely to give up with this service than doing it by yourself. We provide individual one-to-one support with nicotine therapy over a 12-week programme, which also includes the month after you having baby. We do this by home visits. We've got clinic appointments and also telephone support catch-ups to make it as easy as possible for you to quit for good. Quitting smoking at any time during your pregnancy is the best thing you can do for you and your baby. If you would like support in quitting smoking, please ask your midwife to refer you or contact us directly on the Smoking in Pregnancy at uhd.nhs.uk link. Thank you.
Joe's going to join us now to talk about Oh, I was going to go first, wasn't I? I nearly missed my own slot. So I would just like to quickly talk through some awareness on cytomegalovirus. So cytomegalovirus is a common virus that sits harmlessly in most adults. You may end up with the illness and not actually have any symptoms at all, or just a mild cold at worst. And it doesn't really affect us as adults, but it can be very, very dangerous for the unborn baby. 1 in 5 children who are born with cytomegalovirus will develop permanent problems with hearing, physical and motor impairments, learning difficulties and visual impairments. So there's a really important message that we need to spread today, which is how do we reduce the spread of cytomegalovirus? So the main issue is we need to stay away from saliva from children. They're the worst germ spreaders that we will ever possibly meet. And so the guidance here is really to make sure that as a mum with a young child, that you're avoiding sharing things like cutlery, popping their dummy in your mouth for a clean, or sharing their little sippy cups or finishing off their food. It's really important that you get into that habit of washing your hands. So if you have wiped their nose, changed their bottom, it's really, really important to have vigilant hand washing afterwards. One of the hardest messages to spread at the moment is how we love and kiss our children. And it's really important that during your pregnancy, you try to not kiss around the facial area where there may be saliva, and instead for just during the pregnancy to try and kiss on the top of the head and offer comfort in that way instead, and lots of big cuddles and squeezes. It's also really important that our childcare workers are aware of the risk of cytomegalovirus, and so they are super vigilant when they're within the workplace for hand washing and trying to remove any trace of saliva or urine when they're caring for other people's children as well. So just to be super vigilant to reduce the spread of cytomegalovirus. And now we can do your bit, Jo.
Hi, my name's Jo Wall and I work in the Oasis team. So the Oasis team I'm a community midwife, but I just offer additional support to women who need it. And a lot of the women that we look after have mental health problems. So if you have an existing mental health problem prior to becoming pregnant and are taking medication, we just ask that you speak to your GP and the midwife to discuss what medication you're taking at the time and what is safe to be taken during pregnancy. There is medication that can be safe during pregnancy, so just have that conversation with your GP. We do have a perinatal midwife who has just newly been appointed to University Hospitals Dorset maternity team, and she is sort of caring for women and doing joint obstetric clinics to help women manage their mental health during the pregnancy. So a lot of women stay quite stable during the pregnancy when they're on medication. Some people develop new mental health issues during pregnancy, and some women unfortunately become quite acutely unwell. We do in Dorset have a fabulous mother and baby unit at Florence House, where women can go to with their children to recover if they become acutely unwell. And we work alongside the perinatal team at Florence House to provide that support for women. So for you to be able to help yourself when you first become pregnant, if you can have the chat with your GP, or if you're not under any current mental health programmes, you can do coming soon to your Badger Notes. There will be a web link where there's a new tool where you can assess yourself, and depending on what result you get, you can either speak to your GP, you can refer yourself to Steps to Wellbeing, or your midwife, speak to your midwife and they can do that referral for you. Or we can speak to Emily, who is our perinatal mental health midwife, to support you along them lines and link you into other organisations that can offer support during the pregnancy.
Thank you. It's a wonderful team of midwives we've got. So now we're happy to take any questions, and also if there are any topics that you would like us to cover in the future, we'd be really grateful if you could also pop those through for us.
Thank you very much indeed. A great talk. Really, really interesting. And we've had some really good questions already, which I'm going to read from here. First of all, actually, before I do a question, there's a bit of fan mail come through. Hi to Susie, and thank you for being one of my wonderful midwives. There you go. Very well deserved, I'm sure, Susie. Here's a question. It's quite a tricky one to answer, perhaps, but I'll put it out here anyway. Should workplaces be doing more to look after pregnant women? I appreciate this is quite a wide question, but I'd love to hear your response.
It is hard for us to comment because it's really hard for us to follow employee national guidance. All we can ever comment on is what we do within our workplace. So for any of our midwives or support workers or doctors who are pregnant, we would always carry out a risk assessment that should be done at regular intervals throughout the pregnancy to make sure that the workplace is safe for them, and for us as an employer to make sure that we remove and reduce as many of the risks as possible. And we would do that right from the point that the pregnancy was declared, and we would do that at various stages of the pregnancy to help keep our workforce safe. I would suggest talking to your boss or to if you're a big company, to your human resources team, who should be able to give you some guidance. But I would be surprised if your employer wasn't offering you a risk assessment.
Thank you very much indeed. Thank you. Another question here that's come in. There are so many mixed messages around things like Parma ham and even eating Mr. Whippy ice cream. I can't believe that. Help. You're not going to stop people eating Mr. Whippy, are you?
So with regard to Parma ham, generally in this country, it tends to be bought in a packet, so it's processed, so that would be safe. But it's more like the ones that you have hanging in Spain, Italy. You know, you wouldn't want to eat that because bacteria, you don't know how long it's been there for. And Mr. Whippy ice cream, yeah, that is actually, we do recommend avoidance. It's potentially the way it's basically the way it's processed, and the fridge is the machine is turned off every evening, or the van, so it's refrigerated on and off, so it's just the increased risk of bacteria. I won't exactly explain how it's made, because for those Mr. Whippy fans out there, probably put you off for life, but that's potentially the reason why.
Other ice creams are available, I think we should say. There's one from the email, actually. What is a safe amount of wine to drink in a day or a week? Probably a question for all of us. Or is it better not to drink alcohol at all while pregnant?
All of my midwives here are nodding and shaking their heads at the right places. The guidance is no alcohol at all in pregnancy. Over the years, the national guidance keeps changing, but really the only advice that we are confident and happy to give is to say that while you are pregnant, to avoid alcohol totally.
Well, that was very clear. Thank you for that. That was definitely clear. Another question here. I'm asthmatic. I worry about doing exercise and it bringing on an attack. Is my asthma medicine safe for my baby?
Do you want to answer that one?
Yes, so we always advise you speak to your GP regularly about your medications, preferably before you fall pregnant, is have discussions surrounding the medications that you're taking, because some of them you will be asked to reduce or stop completely. Asthma medication, please do continue. That is so important. I think we haven't had many reports of it actually exacerbating asthma pregnancy. Actually, we hear about it reducing the asthma symptoms, but we're all different. Please do continue with your asthma medication. In terms of exercise, it's always good. It's always good. It will exercise your lungs. I don't know how you are with swimming. Swimming's usually very good for very gentle exercise to increase your lung capacity. So really, really important to continue. Please do.
Even things like just taking a walk a day, or, you know, we had loads of excellent items there, didn't we? You know, just cleaning one of your rooms, blitzing your room.
Sorry, I did stop at that one, didn't I? Because you know, it's not just down to one person to clean the house, but it does get your energy levels up. You bring on a sweat, your heart rate goes up, especially if you're having a really good clean. Maybe put the music on at the same time. I think that would be.
We used to quite advise it, because things like, gosh, all the women will shoot me now, but for cleaning the floor, actually that position you have to get into to do it helps your baby to get into the most perfect position for birth. So as much as all the men will love us saying this and all the women will hate us saying this, actually really getting down on the floor and cleaning it will help with the positioning of your baby.
Thank you. I'm saying nothing on that at all. I can read the room. Another question here. It's actually an interesting one. I can't keep anything down from morning sickness. Any tips that would help would be great. I'm looking to you.
Yeah, it's in. Oh, it's a new one on me.
So yeah, that's quite a strong one. It's one of the symptoms that most mums have, isn't it? But it's when it's worse, or it doesn't ease off, or it's at the wrong time of the day, and you expect it to just be in the morning, but it can be throughout the day. It can even be in the evening. Eating little and often, finding things that smell just right for you. So anything chemical, if there's a chemical smell or a fake smell, I call it, it tends to bring it on more, the sickness on more. So you need to find something that you can smell that actually eases it down. Some people are peppermint, some people will have ginger biscuits. Other mums find that too strong. So you're either a cool person or a hot person. Some people prefer the ginger spices to calm things down, and others need the peppermint to cool things down in that way. Avoiding things that actually bring on the smells. There's smoking in pregnancy. I know, Sam, you know, we do have a percentage of women that still continue, but smoke can actually bring on sickness in pregnancy. So you want to avoid smoking. Caffeine can make you feel sick. So we advise usually to stop, or even just have 1 cup of coffee a day. I think that's the new guidance on caffeine. Knitting. Keeping your hands busy. I know that sounds really odd and you know, very, very strange, but knitting or doing something repetitive that keeps your mind off the sickness can actually calm everything down. Listening to music, meditating, anything that calms your system down will be enough to actually help with that. And you can go and see your GP for some anti-sickness tablets as well. That's another thing if it's really, really bad. But yes, going for a walk, smelling things, anything like that.
Right. Thank you. I realise I'm about to hand the microphone straight back to you. So sorry about this. So, if you go there, you can share microphones with Kerry. I'm sure. Yeah, because it's another eating one. I'm a vegan and I worry that I won't be getting enough iron. Can I ask for iron supplements?
Yes, you can. There are quite a few forms of iron that you can have. There's health food shops will provide you with particular iron supplements that are suitable for vegans. There are different types of iron supplements that there's different forms of it now. I know we go with ferrous sulfate is our usual one, but there are, again, some women can't digest that. It doesn't absorb very well. You only absorb a small amount of that. So there are different forms. They're just maybe a little bit more expensive and less well known.
Some vegans have actually got on the diet than eaters.
I was going to say that as well, that quite often vegans really are very careful with their diet. So actually we find often they are the people who are least likely to be anemic. But your blood will be tested at regular intervals throughout your pregnancy, so we can let you know if you are anemic. And with any of the iron supplements that you do take, which you can buy over the counter and just take as a pregnancy multivitamin, will have a good supply of iron in it anyway. We do encourage that you take it with a glass of orange juice because it really helps with the absorption of the iron, and to avoid things like tea and coffee for about an hour afterwards. That 1 cup of coffee needs to wait at least an hour.
Yeah. But also that the butternut squash that I talked about, and I'm going to rave on about the butternut squash, it has got iron in it. There's iron in that, and it's got the vitamin C in there. So if you're not a fan of dried apricots, which has the vitamin C and the iron in, there's the butternut squash, and you can make a soup out of that rather than just, you know. So it's whether you can tolerate fruit or whether you can tolerate vegetables as to what is best for your tummy. But yeah, vegans are usually spot on with their diets. So.
And another one about eating. This is eating post-pregnancy. How many calories can I eat while breastfeeding?
Yeah, it's the one time where you can.
I was just going to say, you burn up to 700 calories a day, so fantastic. So another meal, basically.
You burn up to 700 calories a day as another meal. So very good advice there. Thank you for that. Anything else to add on the keep?
Just a good amount of a diet. Your body is very good at resetting itself afterwards. So just, you know, don't overindulge in one thing. It's just a good moderate diet with lots of different and good. Yes, saturated fats. It's actually the one time when you're breastfeeding.
So just for the sake of people who don't know what a saturated fat is, saturated fats? So cream. Cream.
You can have butter, you can have cream, because your body will use that to produce the milk, and it's a good healthy thing to do when you're pregnant.
And just back to the question, with a question from a vegan earlier. Obviously cream, and that's not appropriate. So what would you recommend for vegans as well?
So
nuts, saturated fats, which are fantastic.
Yeah, any nuts and seeds will have everything, which is why our vegans do very well, because you can get vitamin C, you can get lots of B12, lots of minerals. There's iron in your nuts and seeds as well. So actually you're getting more, I would say, than most people, which is why we say that you can be undernourished by just having your conventional diet, because you may not be reaching for those good vitamins and minerals. But somebody who is vegan, they would already be thinking, I've got to get this vitamin in and that mineral, you know, my iron might be a little bit, but actually they're the ones that are very healthy. It's everyone else we have to worry about.
And nature quite often gets it right, doesn't it? You'll find that a lot of pregnant ladies have quite strange cravings. For me, I suddenly loved fizzy cola bottles and salt and vinegar crisps, and I can't bear either of those things now. And obviously there was something that I was missing in my diet, and there is a lot of belief around the things that you're craving are actually the things that your body needs. Of course, we need to be sensible. There are a few ladies who crave things that are not good to eat, like dirt and coal and sponges. If those events happen, then you do need to let your midwife know. Resist temptation, let your midwife know, and we'll get some help for you.
Is that sponges straight from the sea, sponges, or?
She has sponges. That will, you know, just nibble on the sponge.
I can add no comment. Another question here. Are there any strategies that could help with shortness of breath? I'm on my 3rd trimester.
Her GP or her midwife. I would find out when she would be due and her next appointment. And if she hasn't got one, to maybe call the labour line and just speak to somebody just so we can chat that through. I think that's a little bit more than.
We need to rule out shortness of breath can be a serious sign of lots of problems. It could just be that she's running out of space because baby's now a good size, but we need to rule out all of the serious things that it could actually be instead. So anybody suffering with shortness of breath must be seen by a healthcare professional straight away today.
Very good advice. Thank you for that. Another question's just come through. When can you stop taking vitamin D when pregnant?
Yeah, So the guidance is to take it all of the way through and until you stop breastfeeding.
And actually,
Yes, take my mic.
there are 2 forms of vitamin D. So
It's actually recommended that everybody takes a supplement of vitamin D, all of us. I think sometimes we in the south we feel that we got a lot of sunshine, we're very lucky. But I know local consultant oncologists are actually quite surprised with their cancer patients when they do bloods vitamin D deficiency in this area. So it's something that's recommended for all of us. Obviously, you can get it in your diet, but we would definitely, and we also recommend when babies are born for them to have a vitamin D supplement. We often forget, but the health visitors can advise, and there are free drops available as well.
Thank you so much. Well, that actually brings us to the end of the questions, but it's just falls to me to say a huge thank you for joining us, but also for our amazing team here for doing this talk today, or this series of talks, and answering all these questions. I think really interesting, and I hope really good advice for everybody. So thank you all very much indeed.
Can we just have one last quick thank you to Beth Fletcher, who is our public health midwife, who is pregnant herself and had very much intended to be here today presenting most of this work herself, but she's had to look after her own pregnancy. So we wish her all the best and would like to say thank you very much for helping us with today's presentation. And these guys have done an amazing job, thank you, showing us what superb midwives you are. Thank you.
Thank you.